Today we're going to learn about cytotoxic hypersensitivity.
What is hypersensitivity? It's the immune system is reacting to something in a way that damages the body rather than protecting it. Next, let's move to the definition of cytotoxic hypersensitivity. It is also known as type 2 hypersensitivity, where the immune system mainly produces IgG and IgM antibody classes. The antibodies target and bind to the antigen on the cell surface to activate the complement system.
Okay, so now let's look at the mechanism. How does it happen? There is three main mechanisms of type 2 hypersensitivity. The first one is the antibody and complement mediated destruction. Second one is antibody dependent cell mediated cytotoxicity, also known as ADCC. And the last one is the target cell dysfunction. The first mechanism, antibody and complement mediated destruction, can occur in two ways. The first one is the formation of membrane attack complex, or known as ANC. The target cell expresses antigens that an antibody will come and bind to. Upon binding, the antibody will activate the classical pathway of the complement system. The classical pathway then causes the activation and cleavage of several proteins, specifically the complement protein C1, which leads to activation and cleavage of complement C3 in the C3A and C3B. C3b then activates other proteins, which lead to the formation of a membrane attack complex involving C9 proteins. The membrane attack complex then induces lysis of the target cell. The second way involves opsonizations. Antibodies and the complement protein C3b attach to the target cell and act as opsonase, meaning they attract macrophage to come and phagocyte the target cell. The next mechanism is called antibody-dependent cell-mediated cytotoxicity, or known as ADCC. This mechanism involves antibodies that bind to antigen on target cells that are then recognized by immune cells like macrophage, natural killers or NK cells, eosinophils, and neutrophils using Fc receptors. Once bound to the antibody, this cell can release toxic substance or kernels onto the target cell, causing it to die. ADCC is involved when certain medications act as heptins and bind to target cells. When antibodies bind to these target cells, it then activates complement protein C5a and C3a, which attract white blood cells to the site and carry out ADCC process. The last mechanism is called target cell dysfunction, and the condition is called as Graves' disease. This is an autoimmune condition that involves the follicular cells of the thyroid gland. These cells have receptor for thyroid stimulating hormone or TSH. Under normal condition, TSH will bind with receptor and promotes the production of the thyroid hormones T4 and T3. Graves' disease results when the body mistakenly produces TSI, thyroid stimulating immunoglobulin. They bind to TSH receptors and activate them to cause an increase in the production of T3 and T4. TSI however, is not subject to negative feedback. So, TSI causes the thyroid gland to continually produce thyroid hormones, resulting in hyperthyroidism.
Example of cytotoxic hypersensitivity diseases. The first one is mismatched blood transfusions. Antibodies in the recipient's blood attack the incompatible red blood cell, leading to agglutination and hemolysis. Next is hemolytic disease of newborn. It is incompatibility between the blood type of mother and the baby. It happens most often when Rh negative mother has a baby with a Rh positive father. Graves' disease. It is autoimmune disease which primarily affects the thyroid gland. It is the most common cause of hyperthyroidism. Is autoimmune hemolytic anemia. A person's immune system produces antibody directed against their own red blood cell and reducing the number of oxygen-carrying red blood cells in circulation. Next, immune thrombocytopenia, an illness that can lead to bruising and bleeding. The last one is myasthenia gravis. It causes variable muscle weakness and affects eye, faces, and swallowing. The common symptoms of the six diseases are fever and fatigue, weakness, jaundice, pale skin, shortness of breath, low blood pressure, in severe reaction, and swelling or inflammation in affected tissues.
Nursing role reacted with cytotoxic hypersensitivity. First, it's for prevention. Nurse should double-check the blood types of patients before the transfusions. This is essential to prevent hemolytic reactions. Next, for early recognition of symptoms, nurse should be able to detect warning signs such as fever, chills, hypotension, difficulty of breathing, back pain during and after blood transfusions, and have to report to the doctor immediately if there is. In terms of caring and managing this type 2 hypersensitivity, nurse should stop the blood transfusion immediately if a reaction is suspected, maintain the access of IV with normal saline, and provide the supportive care. Nurse should also monitor the vital signs closely and educate patients with the autoimmune disorder about their condition, treatment, options, and the importance of medication adherence.